Hey there, future civil servants. You know that staying on top of current affairs is key if you're gearing up for the UPSC exam.
Absolutely.
And let's be real.
Yeah.
Few topics are as critical as health,
Right.
especially mental health in India.
Mm-hmm.
It's a recurring theme in the UPSC syllabus,
Yeah.
and for good reason. So today's deep dive is all about dissecting the Union Budget 2025-26
Okay.
and how it tackles this vital issue,
Right.
all based on the Hindu's reporting.
Great.
Ready to decode the budget and score some serious UPSC points.
Let's do it.
Let's jump right in.
It's fascinating to see how this year's budget places health front and center.
Okay.
The Ministry of Health and Family Welfare received a hefty 99,858.56 crore allocation.
Okay.
Now, you might be thinking, okay, big number, but what's the significance?
Exactly. It's easy to get lost in the numbers, right?
Yeah.
Help us break this down.
Sure.
What does this allocation tell us about the government's approach to health,
Okay.
and specifically mental health?
Well, for starters, it's a substantial increase compared to previous years.
Okay.
This signals a clear shift in priorities, recognizing health as a key driver of national development.
Yeah.
And within this broader allocation,
Yeah.
there are some specific highlights that directly address mental health.
Right.
For instance, the National Tele Mental Health Program received 79.6 crore.
Okay.
And there's a significant boost for the National Institute of Mental Health and Neurosciences,
Right.
and NIMHANS.
Interesting. So we're seeing targeted investments in mental health infrastructure and services.
Yes.
This is definitely something UPSC aspirants should be aware of.
Absolutely.
But before we get too deep into the budget specifics,
Yeah.
let's take a step back and define what we mean by mental health.
Okay.
It's a term we hear all the time,
Right.
but what does it actually encompass?
You're right.
Yeah.
Sometimes we use these terms without truly understanding their full scope.
Right.
The World Health Organization defines mental health as a state of well-being, where individuals realize their potential, cope with the normal stresses of life,
Right.
work productively,
Yeah.
and contribute to their communities.
That definition seems pretty broad.
Yeah.
Can you unpack that a bit more for our listeners?
Sure.
What does that actually look like in a person's daily life?
Think of it as your overall emotional and psychological well-being.
Okay.
It's about your ability to handle everyday challenges,
Right.
maintain healthy relationships,
Mm-hmm.
make sound decisions,
Yeah.
and basically live a fulfilling life. When
Right.
your mental health is in good shape, you're able to cope with stress,
Yeah.
work towards your goals,
Yeah.
and contribute to your community.
So it's not just about the absence of mental illness, but about thriving and reaching your full potential.
Right.
That's a crucial distinction.
Absolutely.
But we know that mental health disorders are a reality for millions of Indians.
Yes.
What factors contribute to these challenges?
It's a complex interplay of factors. Imagine a web with threads representing biological, psychological, and social influences.
Right.
There's a genetic component, early life experiences,
Okay.
and then ongoing stressors like poverty, discrimination, or violence.
It sounds like it's not just about individual circumstances,
No.
but also about the systems and structures
Yes.
that create inequalities and impact people's mental well-being.
Precisely. Access to quality education,
Right.
healthcare, social support, these are all crucial factors.
Right.
There are personal stressors,
Okay.
relationship issues,
Yeah.
job insecurity,
Right.
loneliness,
Mhm.
and even the constant pressure to succeed,
Yeah.
especially for those facing the UPSC exam.
And I imagine those pressures are amplified in a country like India,
Oh, absolutely.
where competition is fierce
Yeah.
and societal expectations can be quite high.
Absolutely. The cultural context plays a significant role.
Right.
In India, there's often a stigma associated with mental health issues.
Right.
People might hesitate to seek help due to fear of judgment or discrimination.
That stigma is a huge barrier to accessing care, isn't it?
Absolutely.
It prevents open conversation and creates a culture of silence around mental health.
Exactly. And that silence can have devastating consequences. Right. But let's not forget, mental health is a global concern.
Mm-hmm.
The World Health Organization estimated that in 2019, almost 1 billion people worldwide
Wow.
were living with a mental disorder,
Okay.
primarily anxiety and depression.
Wow, that's a staggering number.
It is.
1 billion people.
Yeah,
That really highlights the scale of this issue.
absolutely.
And those statistics don't even account for the ripple effects on families, communities, and entire economies.
You're right. The
Yeah.
impact is far-reaching.
Right.
And if we zoom in on India,
Yeah.
the statistics are equally alarming.
Okay.
15% of Indian adults
Okay.
are estimated to be dealing with mental health issues.
15%.
Mm.
That means millions of Indians are struggling, yet so many suffer in silence.
Yeah,
It's a crisis that demands attention.
it does.
And speaking of attention,
Yeah,
the budget does shed some light on this issue.
it does. And understanding the nuances of the budget's approach to mental health is crucial for UPSC aspirants.
Okay.
It shows you're aware of the government's priorities and can analyze policy decisions.
Okay, so let's dive back into those budget specifics.
Right.
You mentioned some key allocations earlier.
I did.
Walk us through those and explain what they mean for mental health care in India.
Let's start with that 79.6 crore
Okay.
allocated to the National Tele mental health program.
Right.
This initiative is a game changer, especially in a country as geographically diverse as India.
Yeah.
It leverages technology to provide counseling and care remotely,
Okay.
reaching those in remote areas,
Right.
or those who might face barriers accessing in-person services.
That's a huge step towards making mental health care more accessible.
It is.
But technology alone isn't enough, right? We need trained professionals to provide those services.
Absolutely. And that's where the boost for NIMHANS comes in.
Okay.
This premier institute
Right.
plays a crucial role in training mental health professionals and conducting cutting-edge research.
Okay.
By strengthening NIMHANS,
Yeah.
we're investing in building a robust mental health care workforce
Okay.
and expanding our understanding of mental health challenges.
So we're seeing a two-pronged approach,
Yes.
enhancing accessibility through technology
Right.
and bolstering the capacity of institutions like NIMHANS.
Exactly.
But let's not forget the massive treatment gap we talked about earlier.
Yeah.
A whopping 92% of people with mental health issues in India
Oh, wow.
don't receive the care they need.
That's a lot.
Why is that?
It's a multifaceted issue.
Okay.
One challenge is the lack of clarity
Okay.
in budgetary allocations.
Right.
While the overall health budget has increased,
Mm-hmm.
it's often difficult to track exactly how much is specifically dedicated to mental health. This lack of transparency can hinder effective planning
Yeah.
and implementation of mental health programs.
So it's like trying to solve a puzzle with missing pieces.
Yes.
Without clear data on funding and expenditure,
Right.
it becomes difficult to assess the effectiveness of programs
Yeah.
or identify areas that need more support.
Absolutely.
This is a point worth noting for our UPSC aspirants.
It is.
Analyzing budget trends and identifying gaps is a key skill for policy analysis.
Precisely. And then there's the elephant in the room stigma.
Right.
Despite growing awareness, mental illness is still often seen as a weakness
Mm-hmm.
or something to be ashamed of.
It's that fear of judgment, isn't it?
It is.
The worry about what family, friends, or colleagues might think.
Right.
It's a cultural barrier that prevents people from seeking help.
And that stigma is particularly pronounced in certain professions,
Okay.
like blue-collar workers.
Okay.
They often face demanding and sometimes dangerous work conditions
Right.
with limited access to mental health support.
It's almost as if their mental well-being is an afterthought.
Yeah.
And speaking of afterthoughts,
Uh-huh.
the current legal framework doesn't do much to protect these workers either.
You're referring to the Occupational Safety, Health, and Working Conditions Code of 2020, right?
Yes.
While it focuses on physical safety,
Right.
it largely overlooks mental health concerns.
Mm-hmm.
And the Code on Social Security from the same year
Yeah.
doesn't even recognize mental strain as a compensable injury.
It's a glaring omission.
It is.
And it sends a clear message that mental health isn't considered as important as physical health.
Right.
But wait, don't we have the Mental Health Care Act of 2017?
We do.
That was supposed to be a game changer, right?
It was a landmark legislation, no doubt.
Yeah.
It enshrined access to mental health care as a fundamental right.
Yeah.
However,
Yeah.
recognizing a right on paper
Right.
and ensuring its implementation on the ground are two different things.
So we have the law,
Yeah.
but the reality is that millions of Indians are still struggling to access the mental health care they need.
Sadly, yes.
It's a classic case of policy versus practice,
It is.
something UPSC aspirants should be keenly aware of.
Absolutely. And understanding these implementation challenges is crucial.
Right.
For instance, the Mental Health Care Act
Yeah.
mandates the establishment of mental health review boards in every district.
Right.
These boards are responsible for safeguarding the rights of persons with mental illness.
Okay.
However, many districts still lack these boards,
Yeah.
hindering the Act's effective implementation.
It's like having a car with a powerful engine but flat tires.
Yeah,
It's not going anywhere.
it's not going anywhere.
So while the Mental Health Care Act is a step in the right direction,
Yes.
There's still a long road ahead
There is.
in terms of translating its provisions into tangible change
Right.
for those who need it most.
Absolutely. We need to move beyond legislation and focus on building a comprehensive and inclusive mental health care system.
Right. So we've identified the challenges, the stigma, funding gaps, implementation hurdles.
Yeah.
But let's not end on a gloomy note.
Yeah.
What are some potential solutions?
Right.
What steps can we take to make mental health care in India
Yeah.
truly accessible and inclusive?
That's the million-dollar question.
Okay.
And it's something UPSC examiners might ask you to analyze.
Right.
Remember, understanding problems is one thing, but proposing solutions is where you demonstrate critical thinking and innovative thinking.
Okay, future civil servants, listen up.
Okay.
This is where you need to put on your policymaking hats.
Firstly, tackling stigma requires a multi-pronged approach.
Okay.
We need widespread awareness campaigns that challenge misconceptions and promote open conversations about mental health.
So it's about changing mindsets,
Yes.
creating a culture where seeking help for mental health issues is seen as normal and encouraged,
Absolutely.
just like seeking help for physical health issues.
Exactly. And these campaigns need to be culturally sensitive and tailored to different communities.
Right.
We also need to integrate mental health education into school curricula,
Yeah.
starting at a young age.
Catch them young, right?
Right.
Instill a healthy understanding of mental well-being from the outset.
Exactly.
Oh, no.
Well, addressing those budgetary ambiguities is crucial.
Okay.
We need greater transparency in how mental health funds are allocated and spent.
Right.
This will enable better monitoring and evaluation of programs,
Okay.
ensuring that resources reach those who need them most.
Transparency and accountability are key.
They are.
It's about making sure every rupee allocated to mental health is used effectively.
It is.
Anything else on the policy front?
Remember those codes we discussed?
Yeah.
We need to push for policy reforms that specifically address mental health in the workplace.
Right.
Amending the Occupational Safety, Health, and Working Conditions Code
Right.
to include provisions for mental well-being is crucial.
Yes. It's about recognizing that mental health is as important as physical safety in the workplace.
Absolutely.
And what about the code on Social Security?
Yes.
Shouldn't mental strain be recognized as a legitimate reason for compensation?
Absolutely. Amending the code on Social Security to recognize mental strain as a compensable injury would be a major step forward. It would acknowledge the impact of work-related stress on mental health and provide much-needed support for those struggling with such issues.
So we're talking about policy changes
Yes.
that recognize the interconnectedness of mental health with other aspects of life.
Yes.
Whether it's education, the workplace, or Social Security.
Exactly.
But what about actually delivering mental health care services?
Right.
How do we bridge that treatment gap?
That's where community-based programs come in.
Okay.
We need to strengthen the network of mental health services at the grassroots level,
Okay.
integrating mental health into primary healthcare settings.
So it's about making mental health care accessible where people live,
Yes.
not just in specialized hospitals and urban centers.
Right.
What would that look like in practice?
Imagine a scenario where you visit your local primary health center for a regular checkup.
Okay.
And alongside checking your blood pressure and other vitals,
Right.
the healthcare provider also asks about your mental well-being.
It's about normalizing those conversations,
It is.
making mental health checkups as routine as physical health checkups.
Exactly. And training primary healthcare providers to identify and address common mental health issues is crucial. This task-shifting approach can help bridge the gap in specialist mental health care professionals.
It's about equipping those at the front line of healthcare
Yes.
with the tools and knowledge to provide basic mental health support.
It is.
But what about people who need more specialized care?
That's where initiatives like the National Tele mental health program become invaluable by leveraging technology. We can connect people in remote areas or those with limited mobility to specialist mental health professionals.
It's like bringing the specialist to the patient.
Yes.
Virtually, breaking down geographical barriers.
Exactly.
Any other initiatives worth highlighting?
The Manadarpan initiative,
Okay.
focusing on psychosocial support for students,
Right.
is another great example.
Okay.
Recognizing that students face unique pressures.
Yeah.
This program aims to create supportive environments in educational institutions and equip students with coping skills.
Addressing mental health in educational settings is crucial.
It is.
Especially given the rising rates of stress and anxiety among students.
Yeah.
And we can't forget about suicide prevention.
Right.
What resources are available for those in crisis?
The Curran Helpline, a national suicide prevention helpline, provides 247 support and crisis intervention services. It's a lifeline for individuals experiencing suicidal thoughts or emotional distress.
Having a readily accessible helpline like that can be life-saving.
It can.
It's a critical resource that needs to be widely publicized and promoted.
Absolutely. And remember, these are just a few examples.
Okay.
There are many other initiatives and organizations working tirelessly to improve mental health in India.
It sounds like there's a growing movement.
Yes.
A collective effort to address this crucial issue.
There is.
It's encouraging to see that momentum building.
Yeah.
But let's zoom out for a moment.
Okay.
And think about the bigger picture.
Right.
Are there any global initiatives that India can learn from?
Yes.
Or collaborate with?
Absolutely. The World Health Organization's Comprehensive Mental Health Action Plan for 2013-2030 is a fantastic example. It's a roadmap for countries to strengthen their mental health systems and make services more accessible.
So it's like a blueprint for better mental health care globally.
Yeah.
What are some of the key takeaways from that plan that could be relevant for India?
One of the most important aspects is the emphasis on integrating mental health into primary health care.
Right.
That means making mental health services available at the community level where most people go for their health care needs.
It's that idea of normalizing mental health care, right?
It is.
Making it part of routine checkups.
Yeah.
So it's not seen as something separate or stigmatized.
Exactly. It's about breaking down those barriers and ensuring that people receive care early on before their conditions become more severe.
Okay, so we've got global frameworks, national programs, and local initiatives.
Yes.
It's a multi-layered approach.
It is.
Which makes sense given the complexity of the issue.
Right.
But for our listeners out there, prepping for the UPSC, what are the key takeaways from today's deep dive?
Okay.
What do they absolutely need to know to ace those exam questions?
First and foremost, understanding the scope of the challenge is crucial.
Okay.
Remember those statistics. 15% of Indian adults facing mental health issues with a massive treatment gap. Right. That's a significant public health concern that demands attention.
So, takeaway number one.
Yes.
The mental health crisis in India is real.
Right.
It's widespread.
It is.
And it needs to be on the radar of future policymakers.
Absolutely.
What else?
Understanding the budget's role is key.
Okay.
Analyze those allocations.
Right.
The overall increase in the health budget, the specific funding for mental health programs.
Right.
What does this tell us about the government's priorities?
Yeah.
Are they putting their money where their mouth is?
Takeaway number two.
Yeah.
Pay close attention to the budget.
Right.
It's not just about numbers.
No.
It's a reflection of policy direction and commitment.
It is.
What else should our UPSC aspirants keep in mind?
The interplay of social, economic, and legal factors is crucial.
Okay.
Remember those codes we discussed?
Yeah.
Their limitations in addressing mental health are a prime example of how policy can fall short.
So, takeaway number three.
Okay.
It's not just about healthcare. It's about understanding the broader context.
Yeah.
Poverty, discrimination, workplace stress. These all contribute to the mental health burden. Anything else?
The Mental Health Care Act of 2017 is a landmark legislation.
Right.
But its implementation is crucial.
Okay.
Analyze its strengths, but also be aware of the challenges.
Right.
The lack of mental health review boards in many districts, for instance.
Takeaway number four.
Right.
Legislation is important.
Yes.
But it's just the first step.
It is.
Effective implementation is what translates those rights into reality.
Absolutely.
What's our final takeaway for today?
Be aware of those initiatives, global, national, and local, that are working to improve mental health.
Right.
The WHO's action plan.
Yeah.
The NMHP.
Right.
The Tele mental health program. The Curran Helpline.
Right.
These are all potential solutions that UPSC aspirants should be familiar with.
Takeaway number five.
Yes.
Be solution-oriented.
Absolutely.
It's not enough to identify problems.
Yeah.
You need to understand the strategies and interventions that can make a difference.
Exactly.
All right, future civil servants, we've covered a lot of ground today.
We have.
We've decoded the budget,
Yes.
explored the challenges, and highlighted potential solutions.
Right.
But as you continue your UPSC journey,
Yeah.
here's a thought-provoking question to ponder.
Okay.
What additional policy changes could India implement to bridge that treatment gap?
Right.
And ensure inclusive mental health care for all?
That's the question.
Let us know your thoughts in the comments below.
Yeah.
And if you found this deep dive helpful,
Right.
don't forget to like, subscribe, and share it with your fellow UPSC aspirants.
Please do.
We're all in this together.
Uh-huh.
A big thank you to The Hindu for their insightful reporting.
Thank you.
Which made this deep dive possible.
Yes.
Until next time, keep those brains sharp.
Keep learning.
And remember, mental health matters.